The DHR Health Breast Center of Excellence provides a complete spectrum of collaborative services from initial screening and diagnosis to innovative treatment plans. Today we spoke with breast surgical oncologist Dr. Lisa Chapa, who tells us genetic testing can help identify changes in DNA that could put you at risk for a variety of different cancers.
I think the most common genetic mutation that people know about is the BRCA mutation, which is, commonly associated with the breast cancer, but there are lots and lots of different changes in your DNA. We call them mutations that we can test for.
Dr. Chapa tells us if you're wondering whether or not you should get genetic testing, you should always start by looking at your family history.
So talk with your family members, figure out your family's cancer history on your mom's side and your dad's side. If you're running into a lot of cancer in that family, there's a high possibility that there may be a genetic mutation that is getting passed down generation to generation.
Dr. Chapa explains genetic testing is so important, as in previous years, getting cancer was unpredictable.
But now we've got really precise medicine, precise technology that can identify if you're at high risk for a cancer before you ever get it. And then we can enroll you in high-risk screening programs that we can monitor you very closely in. So these programs aren't going to keep you from getting a cancer, but they're going to help you catch it early. And if we can catch cancers early, a lot of times they're very treatable and curable.
And if you're someone who has already been diagnosed with a cancer, there are still many benefits to having a genetic test performed.
So I'll use the example of a patient who comes to me with breast cancer. A lot of patients come to me already diagnosed with breast cancer. I still will order genetic testing for those patients because, when we say the BRCA gene, we know that is associated with breast cancer, but what a lot of people don't realize is that it's also associated with a high risk of ovarian cancer, pancreatic cancer, skin cancer, and if you're a man, prostate cancer. So we still have all of these other cancers that we need to be monitoring you for with the BRCA gene. So yes, you have breast cancer now, but we need to monitor all the other ones.
You can be certain you're receiving the highest quality of care when you trust the doctors at DHR Health.
Here at the DHR Health Breast Center of Excellence, we provide on-site genetic testing for our patients with breast cancer or patients that have strong family histories of breast cancer. So if you fall into any of those two categories, talk with your primary care provider to see if a referral to our DHR Health Breast Center of Excellence is right for you.
For more information, call 956-362-8170 or visit dhrhealth.com.